Good morning, everyone. Thank you so much, Abdi, and the rest of the team for inviting me to be part of this Los Angeles Dental Symposium. It's a great pleasure and a great honor for me to be part of this symposium, to sharing stage with these monsters of dentistry. I am Joan Gubau Mach. I'm from Barcelona, and I'm a proud member of bioemulation. My work consists on direct anterior composites, so as this is my work, my goal is always to emulate natural teeth, so to emulate nature. I perform my clinical practice in Barcelona Dental Institute, the clinic of my friend and colleague Roberto Padrós. It's a top clinic in Barcelona. I have the privilege of sharing team and just sharing some works with Javier Tapia, that everyone knows Javier, will be lecturing here today and tomorrow, one of the founders of bioemulation. So you can feel how exciting it is to share some works with him, to just work side by side. My work, I'm a specialist on static and restorative dentistry, and my work consists on the emulation of the natural teeth. So I'm going to try to use some composites to stratify and try to emulate this natural texture. I do some smile makeovers, additive smile makeovers, because I like to be conservative. I like to be as more conservative as possible. If it's possible to keep intact the natural teeth under the restorations, will be better. If not, maybe some little adjustment. But this is the goal, to be conservative. So, I'm combining my clinical practice also with the teaching. I have my own 3 days intensive hands-on program about stratification with composite resins on the anterior area in Barcelona Dental Institute. So I'm sharing with the participants what I'm doing on my daily practice, how I'm doing my work, the techniques I'm using, materials I'm using, so trying to share what I'm doing. Also combining this with some courses abroad and lecturing internationally as I'm here today. So I'm going to talk about direct anterior composites, that is my job. So it's equal to say I'm going to talk about how to emulate nature. The first thing I'm doing when I'm receiving a new patient, a new case, is to analyze the situation. I'm going to take lots of photographies because I need to get the information that nature provides in order to try to reproduce it. We need to understand nature. We need to understand the histoanatomy, the different natural structures, natural tissues. And for this, we need to take all this information. So it's in our hands to take all this information, this powerful information that will work on our own benefit and will make the whole thing predictable. So this is the first thing I'm going to do, and I'm going to try to avoid random steps to get the result I'm pretending to obtain. As you can see here, we have different photographies. Of course, I have my protocol. Some of these photographies are regular photographies, macro photographies with twin flashes, with some diffuser, and just taking lots of different angles in order to find out every little detail and to understand the case that I'm facing. But after this, I'm using lots of different tools that will facilitate this procedure of the analysis of the situation. For example, here, the second photography that we can see is done with a cross-polarized filter. A cross-polarized filter, particularly this one is the polarized filter. This cross-polarized filter is a filter where we are going to avoid the surface reflections that we are getting in a regular photography. So if we avoid these surface reflections, we're not going to have these big white spots. A surface reflection is just a big white spot hiding information on the back. So we are going to avoid these reflections. We can get some more information. Additionally, it's a good tool for analyzing the histoanatomy, the internal structures. Will be easier to find out these details. And of course, in these cross-polarized photographies, it's much easier to compare the chromas. So we can see the different chromas between the natural teeth, the existing restorations, or just to compare the chroma of what we are pretending to do at this moment. Then we have another photography here. The third photography you can see in this line is done with a fluorescence filter. A fluorescence filter, particularly this one, is the fluorized 365 nanometer filter. This is the old version of this filter, is working on the wavelengths of 365 nanometers. So we can get the fluorescence, this information, under these 365 nanometers. As you can see, as the natural teeth are fluorescent, we need to emulate this fluorescence with the restorative materials. So here with this filter, we can analyze the difference between, or the situation before the treatment, the different fluorescence that we have. Maybe we have to try to find the materials in order to emulate this fluorescence, even that this is difficult. It's difficult to emulate the natural fluorescence and get a perfect result. Then you have another filter here. This is the fluorized 405 nanometers filter. So this is the new version of this fluorescence filter. This was developed by Javier Tapia and presented a few months ago. So this is something quite new. And this is, as well as the other one, a fluorescence filter. And we are getting the information on the wavelengths of 405 nanometers. So as you can see, these are the same photographies, the same case. With the first filter, we are getting some information. With the, for example, on the right central, there's a composite resin. This composite resin is a bit like showing low fluorescence, but the same one under the 405 nanometers is showing a high fluorescence. So just more information, different fluorescence that we can get on this 405 nanometers filter. The last photography we can see here is a transillumination photography. And this is really important because normally if we are taking the photography, the regular photography from the front, we are going to just shot the light with the flashes. The light is coming from the front and is reflecting to the natural surface. So we are going to get this characteristic like bluish aspect of the incisal third. This is the opalescence. This is the reflected light. But when we are shooting this photography from the front, but instead of shooting the light from the front, we are shooting, or we are passing the light from the back of the mouth to the front, so this light is going through the natural tissues, this will be a transillumination photography. So we are not going to have anymore this bluish aspect of the reflected light. We're going to have this characteristic yellow-orange aspect of these kind of photographies, because this is the transmitted light, the transmitted wavelength passing through the natural tissues. And this is really good tool for evaluating the different opacity or translucency of the natural tissues. So we need to emulate this natural translucency and opacity. We will talk about this later, okay? Then there's another photography. This other photography there. We can take this kind of what we can call a texture photography by just playing with the angulation of the light and just taking the photography from another angle, and we are going to get this image of the natural anatomy or the natural texture if we are doing this before starting the treatment. If we are doing, and we can evaluate what we need to copy, so we need to get this information, what we need to do before starting the treatment. So this is going to be more predictable. And of course, if we are doing this photography later after doing the treatment, we can evaluate what we have created on the restoration, and if it fits, it gets mimetized with the naturals. Okay? So these are some of the photographies I'm doing on my protocol. Of course, we need a portrait photography. We need a relationship of the patient's face, the lips, and the teeth. Okay? So more information that we can have. So let's understand a little bit this kind of analysis I'm doing with a clinical case. This is a patient. This is a dentist. I have to say, I have lots of dentists as a patient. This makes me proud. This makes me happy. Maybe I have to say that the half of my patients are dentists. This makes me happy because it means that someone that from the same job, from the same profession, is choosing me for doing a work. So this means like they are trusting that what I'm doing. So I'm really happy. But also I have to say that the dentist, I include myself in the pack, okay? The dentist, we are a little bit complicated as a patient. We are difficult because we really know what we want. So as we know what we want, of course we are strict on the results. So this make like the pressure going a bit higher, okay? But just kidding, I'm happy with this, and is what actually I prefer to do, just to do my best for getting the best result. So well, let's analyze the situation. The first thing that the patient requested was this white spot here on the right central. Obviously, this is the most visual thing that we need to change or to modify. So, okay, let's understand how we can treat this. But additionally, this is a patient after the orthodontic treatment. So this also happens often. I receive some patients from maybe other clinics. Of course, in Barcelona Dental Institute, we are doing orthodontic treatment also, and I'm receiving the patients. But some other clinics are sending me some cases because due to some recommendation, something like this. So I receive these patients, I analyze the situation, and the patient was saying, after the orthodontic treatment, I'm not feeling completely happy with my smile. Can you do something? And another request from the patient, can you do something conservatively without trimming my natural teeth? This is quite, it happens often. I have this request. So, okay, let me analyze the situation. First of all, we can see that the centrals, maybe one of the centrals is a bit shorter. This is a critical situation. As closer from the midline, more critical is the aesthetic. So here, of course, one thing I will try to improve is to adjust the length of both centrals. Maybe I'm going to work a little bit on reshaping the incisal edge of the other central, as I can see a little bit worn out also. So additionally, I said to the patient, look at your canines. Can you see that these canines are as long as your premolars? This should not be like that. They should be a bit longer. These are little patterns that we should try to reproduce in order to create beautiful or aesthetically acceptable smiles. So if I said to her, if we are reshaping a little bit or restoring the cusp of the canine, aesthetically, the visual aspect will be better because we are restoring the natural anatomy, but additionally, we are going to improve the function. And this is also important because we need to try to make more efficient the anterior disocclusion and anterior guidances. So, well, just this is my plan. Also, the patient just requests for the black triangle between the right central and the right lateral. And I said, okay, no problem, but what about the black triangle between the left one and the left central and left lateral? She said, I cannot see so much that one, so no problem. Just let's make the patient happy. So we're gonna leave this one, okay? So the idea of the treatment is this one. Let's take a photography with the cross-polarized filter. We can analyze the chroma really well. We can find out all the little details. And of course, we can see really visual this white spot that is really kind of strong, okay? So my idea is I'm going to try to treat this as more conservative as possible. So the idea was, okay, I'm going to try to use some resin infiltration. Do you know ICON, the resin infiltration treatment, where we can be really conservative. But for understanding the situation, I need to do another photography, and this is the transillumination photography, because I need to do a correct diagnosis of the potential problem of this white spot. When we have a white spot, and we are doing a transillumination photography, we can see the real amount of problem that we have. If this white spot appear dark, it means that this white spot will be deep, okay? So maybe it's gonna be a bit more difficult to treat. I need to make sure that the resin will infiltrate till the deepness of this white spot. So another time, this photography or another filter can help to understand the situation. So this is the day of the treatment. Absolute isolation, air abrasion over all the surfaces where I expect to reach with the composite, because I want to have a good adhesion, and everything is ready. I'm not going to use the drill, the bore, anything. This is 100% conservative, just air abrasion. Only I'm going to insist some more time with the air abrasion over the white spot, because I want to like slightly erode a little bit more for make sure that the infiltration will reach to the end. So this is the aspect after the air abrasion. Some part of this white spot, the more superficial, has disappeared, but the rest still there. So, okay, I'm going to try the icon infiltration. After several times of the acid etching, just finally the infiltration reached the bottom, so it means that the white spot completely disappeared, okay? So now I have this situation. I'm going to try to start with the bonding, with the composite, to adjust little things. I'm going to lengthen a little bit this left central. I'm going to reshape slightly the incisal edge, incisal margin of the right central, and after this, I just want to keep visible the natural effects. So I'm going to try some material composite that it will look like translucent, because I want to keep visible these natural effects. As you can see here, due to the erosion with the air abrasion, there's a bit of a lack of opacity in some area. So I'm going to use some different material, maybe semi-translucent, to correct this natural opacity to look like the left one, and then I'm going to make something translucent for keeping everything visible. Something similar I'm going to do on the canine, just reshaping, keeping visible the natural buccal enamel as much as possible, because actually there's no problem with the chroma on this patient. We're going to keep the same color. So perfect, just close the black space with some chromatic enamel, and of course I do the polishing. I wait like 1 week, and this is the photography after 1 week, after the treatment, so we can see that we cannot see anymore where the composite is, okay? The material is blended with the natural tissues. This is the goal, to make the restorations looking like invisible. And I would say maybe the best idea when we are facing a case is to use as less composite as possible. The natural enamel is beautiful. We can do beautiful things with the composite, but as more composite we are using, more difficult. So if we have the idea of facing a treatment, as less composite we are using, much better. And this composite should be blended with the surface. So photography with the fluorescence filter, this is a 405 nanometer filter, and we can see here the, where the composite is, okay? This is like just a little bit of edge bonding on both centrals, this black space closure, and the canine. So after this, we can see that everything is blended, everything is mimetized with the natural tissues, and this is the goal, this is the idea, okay? We can see this cross-polarized photography where we cannot see differences on the, with the chromas, okay? And again, this transillumination photography where now the natural opacity and natural translucency has been emulated. So this case will look beautiful on under the sunlight ambience when the patient is taking the selfie, or when the patient is looking on the mirror with the light coming in front of from the front of the restoration, or when we are taking a professional photography. Because the natural tissues, the opacity, translucency of the natural tissues has been emulated. So this is the goal, this is the idea of the thing. Of course, what we need to understand is that if we are pretending to emulate nature and we are analyzing all these details, we need to understand and be familiarized with the materials that we are pretending to use. Otherwise, we cannot be able to copy what we are analyzing. So it's really important to understand and be familiarized with these materials. We can classify the composite like different ways. Maybe one of these classification is depending on the visual aspect of these materials, regarding the translucency or opacity of these materials. And then we have another classification that is depending on the filler particles of these materials. So let's take the first classification first regarding the opacity translucency. We have different kind of materials. We have a material we can call dentine composite. This has a similar opacity as the natural dentine. So this is the substitute of the natural dentine. As this is opaque, or has some degree of opacity, this will permit to hide some things that maybe we want to hide from to be seen through the restoration. And as this is opaque and the light will get reflected better than the translucent materials, so this will provide this kind of chromacity too, okay? So we can get some opacity, we can get some chromacity from this material, from the substitute of the natural dentine. Then we have another material that is a substitute of the natural enamel. And this is not the second one that you can see here is called chromatic enamel. The substitute of the natural enamel is what is called the achromatic enamel, because the natural enamel is achromatic. It's translucent. In the natural tooth, the color is provided by the dentine and the inner tissues, the pulp and everything, and then is modified by this translucent enamel. The light interacting with the enamel rods produce this beautiful effect, and we can see this going to be modified. So we need to emulate the same thing. We need a translucent material to keep visible the inner effects that we are creating. So this is the chromatic enamel. This is a substitute of the natural enamel, and this provides this kind of translucency. There's another material, as you can see in the middle of the dentine and the achromatic is called chromatic enamel. This doesn't exist on the nature. This is an enamel composite with some kind of pigment, with some kind of chroma. So it's semi-translucent. We can see maybe it's in a middle point between the opacity of the dentine composite and the achromatic enamel. So as we have this middle opacity or translucency, this semi-translucency, this can help to push a little bit the value, the luminosity in certain areas. This will provide some chromacity. So also maybe it can be done like a transition between the natural teeth and the restoration to create some kind of, to help to blend the restoration. We can use more tools that we have available in order to use and to solve the situation. And then we have this, what is called effect enamel. This is more translucent than the natural enamel. And I'm not going to use this for the outer layers. I'm going to limit this to the inner effects because this is maybe we can call effect enamel or opalescent enamel. So this will work to heighten the opalescent effect of the restoration. Additionally, we can use some stains in order to create, to copy some natural details that we can analyze. And then we have this other classification depending on the filler particles. This is to summarize a little bit what a composite resin is. We have an organic part, is the resin, and inorganic part, these are the ceramic filler particles. So depending on the amount in weight and in volume of these filler particles and depending on the shape, on the size, on the distribution of these filler particles will provide different properties to the composite resins. So just in general terms, we can summarize this as if we have bigger particles on the composite resin, this composite will be more resistant. The mechanical properties will be better, so not as easy to fracture as other composites. But on the other side, this will be less polishable. The level of surface roughness that we can reach here will be higher, so not going to be as glossy as other composites with smaller filler particles. The composites with smaller filler particles are much more polishable. We can achieve natural-like gloss, and this gloss will be long-lasting. But on the other side, this will be weaker, easier to get fractured, okay? So depending on the situation, we need to understand and we need to choose the right materials. Maybe if we are concerned about the resistance in some kind of patients, we can use stronger materials like microhybrid, nanohybrid. Maybe in another situation, we don't have to be as concerned about this resistance. Maybe we can be more concerned about the polishability, so we can use other kind of materials. Or even we can mix, and we can use some stronger materials for the inner layers or lingual layers. We can use some other stronger materials for the outer layers to get more natural polishability. So the idea is to understand the situation, analyze the situation, and to know and to be familiarized with the composites that we are going to use, with the material that we are going to use. Let's see a quick clinical case. This is a little fracture, not a big thing, okay? This little fracture, as you can see, this is a corner on the incisal edge. So do you think, as this is a little fracture, do you think we can solve this situation with one single composite? I should say, I'm sorry, but no. Because look at this. Look at this triangle here, equivalent to this fracture on this natural central. Can you see how many different details we have there? If we are not emulating all these different details, we are not going to be able to restore this. So as you can see here, we have some areas where there is dentin, and these areas are more opaque. Then maybe on the end of these mamelons, we can see a higher saturation, a higher chroma. We need to emulate these. So maybe we need a dentin composite to emulate this opacity. Maybe we can use even some stains or some chromatic material to emulate this chromacity. On the end of the mamelons, maybe there is some, as you can see, later we can see some grayish area. This is enamel without dentin on the back. So we have much more translucency. The value is much lower on that areas. So we need to emulate this with some translucent material, and this would be the achromatic enamel, the substitute of the natural enamel. Maybe you also can see some incisal white alloy. This incisal white alloy is this kind of frame that is limiting the incisal edge. And this is the natural enamel. There's no different enamel there. It's the natural enamel changing the inclination of the enamel rods, and due to the anatomy on the lingual slope is providing this kind of extra translucency due to the relation, the incidence with the light. So we have this effect that also we should reproduce. We can use some chromatic enamel, we can use some tints or stains, we can do different ways. But the idea is we need to analyze everything. We need to understand the situation. And if we understand the situation and we choose the right materials to substitute every little detail, we can get a result similar to the natural. The result not going to be perfect, but if we are trying to emulate more different details, is not as critical if the selection is not perfect in one of these details. So the idea is trying to emulate this histoanatomy, trying to emulate these natural details, and make as if the accident that made the central fracture on the patient never happened before. So we need to try to restore the nature and make the restoration completely integrated and invisible. So in these cases, where we are doing, for example, one single central restoration, or one central and one lateral, but not involving all the anterior teeth, here in these situations, we need to strictly copy the natural neighbors. So if we are doing a single central, we need to copy the natural central on the side. Here we cannot be creative. We need to strictly copy everything. If we are creative here, we are going to fail. We need to analyze the situation and try to copy what we have. So for doing this, we need to understand the different stages of the human tooth aging. If we are doing, for example, a restoration of a fracture central, and we are modeling the dentin mamelons, and we are creating this space free of dentin down the mamelons till reaching the incisal edge, and we are doing a beautiful incisal alloy on a patient that is old and the neighbor, the real central, is worn out and is showing like a situation similar as this one. This doesn't make sense. We need to understand the situation. We cannot be creative here, even that is beautiful to do this natural, young looking teeth. But this is not the situation, okay? We need to understand when the patient is young, maybe there is some distance between the dentin mamelons and the incisal margin. But as the patient is going a bit older, this distance will be shortened because there's some wear on the incisal. Not only on the incisal edge, also on the buccal enamel. There's some wear on the buccal enamel, so we are losing thickness of this enamel. This enamel, as it's losing thickness, is getting a bit more translucent. And as the patient is getting older, the dentin will reach the incisal margin. There's no even distance in some cases, not always. In some cases, there's no distance even between the dentin and the incisal margin because this has reached the incisal margin. And of course, here the enamel, the buccal enamel is even thinner. The dentin is getting sclerotic, is getting more translucent, but is getting more saturated. So we have these different stages that we need to understand in order to emulate a natural tooth and avoid being creative here in these cases. Okay, so let's analyze another case. This is another patient. This is another dentist. Let's add some pressure to the equation. This is also a classmate from the uni. So he's a patient and a friend. So let's increase the pressure a little bit. Just kidding, because I'm really happy having these situations. So look at these centrals. These centrals are beautiful, natural centrals, but we can see some kind of restoration, isn't it? We can see some restoration there. This is a diastema closure. So the patient, she's dentist, she did herself the diastema closure in front of the mirror. And she was extremely happy with the result. Obviously, the request of the patient was to replace the laterals and the canines composite restorations because she was not happy with it. But I suggest, what about if I can replace also the diastema closure? But she said, no, I'm extremely happy with it, so please leave it there. Okay, so I could get the authorization just for polishing a little bit, and I would be happy with that, just by doing that. So, okay, the idea of the treatment here will be to copy these centrals on the rest of how these centrals look on the rest of the restoration. So we have to evaluate the situation, because if we are not understanding the situation, we don't know if we can improve it. Okay, so maybe we have to say to the patient, I cannot do anything here. You have to maybe search for another clinician because I cannot improve the situation. So let's analyze a little bit. We can take, again, a photo with the cross-polarized filter, the polarized, and we can see this difference on the chroma that was evident on the regular photography also. We have this difference on the chroma between the centrals and the restorations. Okay, so this is one of the things that I can improve from this case. I can try to change this chromacity, this chroma, between the centrals and the restorations, even the premolars that are a bit different. So this is one thing that I can do. I have one more thing to adjust. Then we can have a fluorescence photography. This is done with the fluorized 365 nanometers filter. And we can see the different fluorescence of the restorative material that the patient has there. We have different composites. Maybe this treatment has done or has been adjusted by different clinicians. As you can see, different fluorescence by different materials used here, okay? But this is useful to understand where the composite is, how this composite look under this fluorescence. And of course, we need to try to emulate it. But the interesting photography here is this one. Again, the transillumination, because you can see the natural translucency of these centrals. You can see the natural effect, and you can see the opacity of the restorations. These restorations are completely opaque. So, of course, if we are just trying to improve this, one more thing that we can add to the pack to improve, then it's going to look better. Of course, we can improve the anatomy, we can improve some other details, but let's understand what we can change. Let's analyze a little bit the chroma of this situation. As you can see, we have to take the reference of the centrals as are the natural ones, okay? So we need to copy the centrals, or how the centrals look, in order to mimetize the rest. So we can evaluate a little bit the situation. We can see there's more chromacity, more saturation on the cervical third. As closer to the cervical margin, we're going to get more saturation. So this is the situation there. The chroma is higher there. If we are going a bit lower, we gonna see that this chroma is decreasing. So as the chroma is decreasing, also the value is going upper, because the chroma and the value is related as this inverse relationship. As lower is the chroma, higher is the value. So in this area, the chroma will be a bit lower, will be a bit bleacher, will be a bit more luminous area, okay? And as we analyze a bit more and we go a bit more down, we can see that this area showing the dentin mamelons is looking a bit more saturated. So another thing that I can add to the equation, around these dentin mamelons, I can see this translucent area. Another thing that I have to emulate, some achromatic enamel to emulate this natural enamel. And of course, we can see some frame, white frame on the end of the incisal margin that also we need to reproduce. Maybe even there are some other details that we can reproduce with some stains. But we need to understand this. If we understand this, maybe we can be able to reproduce a natural tooth and to copy the real one. So this is the personalized shade guide. I select the colors with a personalized shade guide done with the same material, the same composite I'm going to use for the case, because this will be more accurate measurement. I have a real view of the same material I'm going to use in the same thickness or similar thickness, so I have a more realistic perspective of what I'm pretending to do. So I select the tones with my personalized shade guide, and after this, I go to the direct approach. This is the situation after removing all restorations really carefully. Of course, first the absolute isolation and removing the restorations, air abrasion, etc. And then we can see this. Look, the situation on the laterals is not so bad. But look at the canines, are devastated, really bad situation. So, okay, I'm going to start, as I can see the real situation now, I'm going to start with the layering. I'm going to use maybe some opaque materials to control this chroma, this saturation of the canines, as I cannot do internal bleaching to modify this. So I'm going to play with the opacity. I'm going to play with the achromatic material for emulating this natural translucency on the edge. I'm going to use, maybe take advantage of some other materials as the chromatic enamel to reproduce some little details. I'm going to use maybe some stains to reproducing other details on the incisal edge. And after this, I'm going to place achromatic enamel again just to make everything visible, all the effects that I have created to keep it visible as it happened on the natural situation. So after this, I polish, I send the patient home. After 1 week, the patient comes, and this is the situation, okay? Okay, the situation has improved a little bit. Now we have certain effects similar as the natural centrals. So this can be a bit more blended, a bit more mimetized. The patient, the result not going to be completely perfect maybe, but it's working for the patient in much better situation. So we can analyze the chroma. We have more saturation on the cervical, a bit lower chroma on the middle, more luminosity. We have this kind of certain extra chroma on the incisal mamelons. We have this translucency, we have these effects, and this can be is making the difference. Now we have different chromacity. We have the fluorescence. This is under the 365 nanometers wavelength. So here it looks good. If we do the same under the 405 nanometers wavelength, this will look really bright. So this is just how it looks under this wavelength. It looks good, but doesn't mean that it's perfect because it's going to change, okay? But then we have this photography, and this is really important here. Transillumination, and this makes the difference. Now there is natural translucency here, similar to the natural effect of the centrals. So this patient, even that on the photography, the result look good. When the patient is out on the sunlight and take the selfie, it's going to look good because the light will come from different places and the natural opacity and translucency will be emulated. So this is the idea. if we understand the different natural tissues and we understand the restorative materials that we have available to treat it, we need to understand also that in a same case, of course, the ideal situation is that I can lengthen all the teeth and emulate this natural effect with the composites by using some opaque materials, some translucent materials, and this will look natural-like. This will look beautiful and realistic. But unfortunately, we are not having this situation all the time. In some cases, we can lengthen some of the tooth, but some others maybe are long enough and we cannot lengthen. And maybe some others, the substrate is dark, and for some reason we cannot do internal bleaching. So in these situations, we also need to get a result looking like natural. And maybe we have to take different strategies for the layering to getting this natural result, but doing different things in the different restorations we are doing. So let's understand the situation first. This is a situation where we have a fracture central. This is a typical one central get fracture, and we have this fracture here, and normally in this situation we are going to treat only one central. The rest, the neighbors, are not getting treated. We have to copy that ones. So these neighbors will indicate the volume of the buccal face. We cannot be additive in these treatments, because if we are going to be additive, this is going to look bulky, not going to look beautiful. So the neighbors are indicating the buccal volume. There's another situation here. This is just a little bit of wear on the incisal edge. But we have to be aware if this incisal wear is creating a sharp edge. Because if this is creating a sharp edge, maybe we can think about a modification. But here, maybe this case and this case, I'm going to be additive. I'm going to treat the whole anterior teeth. So it means that I can play with the volumes. I can be additive. This helps to be conservative. In a situation like this, I'm going to be additive. The tooth is natural, intact, with rounded shapes, smooth contours. So I'm not going to do anything here. For some reason, I have to modify the length or the shape or the volume or whatever. So I'm going to be additive. I'm going to perform only air abrasion, 100% conservative. The teeth is intact down the restoration. What about here in these both situations? So here, I have to do a preparation because I have to keep the natural contour indicated by the neighbors. So here, I have to make some space in order to hide the fracture line. I like to do a rounded bevel here because it helped me to blend a little bit easily the material, the restoration, okay? So I have to do some preparation, minimal invasive preparation, but here I have to do some kind of preparation. Here, as I'm going to be additive, as I explained the situation that I'm doing all the anteriors, I'm going to be additive. So I get this space by being additive, so I don't need to do anything else than just rounding this sharp edge. Because if there's a sharp edge, I want to improve the biomechanics of the restoration. If I have a sharp edge, this is a potential fracture line if there's some hit or some impact there. Additionally, it can be visible maybe through the restoration. So I'm just going to slightly round this sharp edge to make the thing much better biomechanically talking. And here, I'm not going to do anything. Just be additive, just air abrasion on the surface, nothing else. Then we can think other situations that we're going to happen. It's going to happen on the same case. Maybe we can lengthen in some of the teeth that we are restoring. This is the ideal situation because I can emulate this natural effect by using different opacities and translucencies of the different composites. But not always going to be like that. In some of the teeth, I can lengthen maybe. On the other, maybe I cannot lengthen. So maybe if I cannot lengthen, but I have to modify the chroma or the shape or the aspect in some way, maybe I can think about using some stains to emulate this natural effect. Because anyway, I want this to look like natural. And another thing that we can analyze or we can think before starting the case is the buccal extension. If the color of the substrate is correct. We're not going to change so much the shade. I don't even need to think about reaching the the cervical margin. I can just extend the material. This is going to be blended with the cervical enamel, and that's going to be perfect. I get advantage of this chroma of the cervical, this saturation, natural saturation of the cervical, and this is going to get blended with the restoration. But what about if we have a dark substrate, and the substrate, for some reason, we cannot do any kind of internal bleaching? If this dark substrate is not so bad, okay, maybe we can be just additive. We don't need to do any prep, but we will need to reach maybe to the cervical because we need to modify this color. And if the color is really bad, maybe, yes, here we have to do a prep, and we have to make some space in order to hide the dark substrate. And this is an exception. And if I can, I'm going to do internal bleaching. So let's analyze another case. This is a case. This time is not a dentist, but she's the friend of a dentist. Always there's some dentist messing around there. So this is the patient came just recommended by a dentist. Actually, this dentist did the orthodontic treatment. So as you can see, we have obviously some spaces there, microdontic laterals. We have to increase the volume there. But as you can see, maybe I can feel all the things that I can improve. So I'm going to explain to the patient, and maybe the patient accept to change that situation. First of all, we can see that there are full of scratches on the natural enamel, and this is a pity because it's just natural enamel, sound enamel, but really scratched, like maybe from removing the orthodontics or something like this, but this is in really bad condition. So, okay, maybe I can think about, I want to dress, again, this buccal surface with some artificial enamel. I'm going to use some composite to improve this situation. At the same time, you can see that there is some difference on the length of the centrals. Slightly difference, but I want to try to adjust this, okay? So I suggest to the patient we can do something on the centrals. Obviously, the patient wants to do something on the laterals because this is the request, the main request of the patient. So I have to modify the volume, the length, and everything. And then we have a difference on the chroma of the canines. As you can see this cross-polarized photography, the canines are really saturated. This is natural, always happen, but in this case was especially saturated. The patient was not so happy with this. Okay, no problem. So I'm going to try to dress a little bit the worn out enamel from the buccal, and I'm going to use some material chromacity for hiding this chroma. So as you can see here, this is a beautiful natural translucency that we have to emulate. So as you can see here in this case, I have different situations that I have to try to solve. Surprise, we are doing the fluorescence filter, and we can see lots of remaining pieces of composite from the orthodontic. So more information, something that can be really helpful. I have to remove all these, I have to clean everything, and even in the posteriors and everything. Again, personalized shade guide, I analyze what I have, I analyze what I want to get, and I select the materials. The case after the removing the remaining pieces of composite, the rest just air abrasion. I don't want to prepare anything. 100% additive, 100% non-invasive. Absolute isolation, everything is ready. So let's start with the layering. And here on the laterals, okay, I lengthen, I get some volume. I'm going to create this natural-like effect with the composite resins. I play with some stains. Then on the centrals, I just want to adjust a little bit the length of one of them. I'm going to keep visible everything because the patient has already beautiful natural effect. So I'm going to keep this visible. And on the canines, actually I'm not going to lengthen. I just will slightly modify the shape of the incisal margin. But this canines has no translucencies, not so much, and also I have to play with the chromacity. So here, I'm going to use some stains to emulate this natural translucency. So This is after placing the achromatic material to keep everything visible down the restoration. Polishing process, after 1 week, I receive the patient again, and I analyze the situation. So as you can see here, the layering strategy was different on the canines, on the laterals, and on the centrals, but the result can be quite similar. So this is the idea. We need to understand the layering strategy, the situation that we are facing, in order to improve the situation and get a natural result. This is the fluorescence filter, 365, 405. We can see the difference under this different wavelength, cross-polarized, everything more or less integrated with the chroma, the transillumination, emulating the natural translucency and opacity, and this is all. Then we are going to have other cases where I'm going to do like veneers, additive veneers, and maybe these veneers are involving all the anterior area, even taking some premolars maybe. So in these cases, yes, I can be a bit more creative, but I can be creative following the natural patterns. I cannot invent it. I need to just understand the natural patterns, and I try to reproduce these natural patterns. But here, yes, I can choose what to do. I can be more creative. So we need to understand the visual aspect of the natural tooth. We have more saturation on the cervical. As we said before, the saturation decreases a little bit on the middle part. The value goes higher. Then we have this incisal third that mixes some opacity, some translucency, some different effects. So we have these different situations. Additionally, there are some studies that analyze what we can call the opalescence layer. Is this opalescent effect shown on the natural teeth of the patients? So they are receiving different patients and observing how this opalescence is looking on the different centrals of the different patients. So we have different patterns that maybe we can try to reproduce to, be creative, but following the natural patterns. So maybe in some of these cases, these patterns are more like trilobular. In others are trilobular, but with additional invaginations in between. Then we have other that may be going to be a bit more diffuse. So we can do something like more like a comb in order to reproduce this. Then we have others where we cannot see so much these invaginations, but this opalescence is concentrated on the cervical, on the incisal margin and the proximals. And then in some other cases, maybe the mamelon, the mesial and distal mamelon is more visible, the central is more diffuse, or even mixed with some kind of stain. So if we are trying to play with the opaque materials and translucent materials and trying to reproduce all these things, maybe we can get some natural looking result. Being creative, because we can choose what to do, because we are free there now, we are doing all the anteriors, but yeah, following these natural patterns. So well, this is the last case I'm going to show today, and this is a patient that came to the office after the orthodontic treatment. As you can see, this is quite happening often. Orthodontic treatment and aesthetic treatment with composite, conservative aesthetic treatment, is like really a good thing. We can just make some adjustments and really improve the situation. So well, this is the patient. Obviously, the main request was the laterals. There was kind of microdontic laterals, some spaces, some diastemas between the laterals and the centrals and the canines. So this is the main thing to do. But also the patient said to me just, I feel I finished the orthodontic treatment and I'm not completely happy with the result. So I see that my teeth are too small for my mouth. So I would like to improve a little bit the volume and the shape. I would like to, if you can do something, of course, again, the same request as always, without trimming my naturals, to improve the situation. Okay, so I can try to analyze the thing. As I have to increase the width of the laterals, I will change the kind of the ratio between the length and the width of the laterals. And maybe I'm going to change also this proportion on the centrals if I have to play a bit with the width on the sides. So what it means, we have an ideal proportion that we should reproduce. If we are modifying this, maybe not going to be as aesthetically acceptable. So I'm going to try to measure the width, the lengths, and I'm going to try to find these little knobs that I can turn to adjust and to improve the situation. So, okay, yes, I can lengthen the centrals because are not enough long, or are long enough but could be longer. If I'm doing a central measuring 13 millimeters, this will be too long. So I can adjust these little things. If I analyze the situation, I'm going to lengthen a bit the centrals. It will look better. I'm going to lengthen the laterals, play with the width and the volume. I'm going to slightly modify the shape and the progression between the posteriors and the anteriors. On the premolars and the canines, of course, I'm going to modify the shade. And first of all, what I'm doing is to trying this with the wax up. I like to do the wax up myself, and I do it with the traditional way with wax, because in some way it will help to test the anatomical design that I'm going to perform later. Here, as you can see, the design is quite flat. I don't care because I will modify later. This is just an idea of what I have to do. So this is the day of the treatment. Nothing else than air abrasion, 100% additive case, non-invasive, 100% conservative. So absolute isolation, air abrasion, nothing else. With the silicon index is the tool that will transfer this information from the design, from the wax up to the patient. I will avoid improvisation and measuring and everything. I transfer this information. I place it on the silicon index. I transfer really thin layer of achromatic translucent material. Then I'm going to play with some kind of opacity, maybe semi-translucent, like chromatic enamel, to play with these effects that I'm going to get on the incisal third. And after this, when I have all the effects done, I'm going to place the achromatic material to keep everything visible again. And of course, this slightly over volume. I need this room in order to adjust different things, because I need to correct things during the polishing. So this will be like kind of sculpture. Okay, so I have to reduce some areas, I have to modify some areas, so I need this over volume. After this polishing process, I send the patient home, the patient comes 1 week later, and we have the veneers done. These are the full composite veneers, maybe some piece of the natural enamel visible on the cervicals, but as we can see, there's some kind of chromacity, different chromacity from the cervical to the incisal that will look like natural. Not only this, if we are playing with the natural anatomy, just sculpting then some anatomy, sculpting there some texture, we can do that these veneers that are full veneers, and is maybe the most difficult way to get some natural looking result, look like natural teeth. So this is the goal. The goal is always to obtain a natural result, because I want that when someone sees my patient, look, wow, you have a beautiful natural teeth, really like bleach, really beautiful, but natural. I don't want to think, okay, someone did some veneers to you. So the goal is to reproduce the natural teeth even we are doing veneers, and to get some natural looking result. And this is another photography for evaluating the anatomy, evaluating the texture, okay? So that's all. This is the idea of the treatments, to be as more conservative as possible. We have the chance of using composite, that is a material that allow me to do really conservative treatments. The majority maybe non-prep. If I have non-prep, I have another advantage. the possibility of reversibility, even not happening so much, but I have the chance of removing and go back to the beginning. And it's a material that can be modifiable later or repairable if I have a fracture. So this is really good. The difficult point is that composite resin, to get results equal to ceramic, requires some training, some experience. So the learning curve is slow, and we need to get some skills to do it. When we are doing, we have a material that is getting all these benefits that we don't have with other materials, and we can do these conservative treatments. So thank you so much. That's all. I hope that you could enjoy the lecture. And again, thank you so much for inviting me. It was a great pleasure.
It is. So great.
Thank you so much.
It is